Hi, my name is Cheryl Banks and I am coming to you sharing my chemotherapy colorectal cancer story. And the reason I wanted to do this is just because when I was checking out YouTube and the internet, I didn't find a lot that made me feel better, made me feel more informed. So I said that, I believe that God takes us through things and we are supposed to share with others so that they are better equipped. Okay, so I was, last year, at the end of the year, I started having irregular bowel movements. And it kind of went on for some while, and then Halloween night, I actually felt a mass on the left side of myself, about right here. So I waited until my insurance kicked in on January 1 and went to get my well woman exam to ask her what type of doctor do I need to see, and she said gastro. So I booked an appointment with Dr. Manji here in Houston for a gastrointestinal, for him to check it out. He's a gastrointestinal, I can't say it, gastrointestinal, I'll say it later. I can't talk right now. What is it? Gastrointestinal, I need to see it written down. Anyway, I went to a gastro doctor. How about that? Okay, so I went to see him and he ordered colonoscopy. Now I'm 53 years old. And this was my first colonoscopy. And when I went, he did that. Just to tell you, if you've not had that, that's a hot mess. The preparation, the colonoscopy itself is wonderful. You're out. I was out for 15, 20 minutes and felt like I had slept for 24 hours, the best sleep of my life. But I got it, and it came back where there was a mass. He took pictures and it was ugly, just ugly. You could tell it wasn't normal. It was cancer. And he referred me to Dr. Mahmood, who is a colorectal surgeon. So I got set up and had my surgery to have a colon resection on February 13th, the day before Valentine's Day. Yeah. Did that, and I was in the hospital for 3 days. They actually cut the cancer out and put the colon back together. I did not have to do the bag or anything, the colostomy bag. So got out of the hospital, and like 4 weeks later, I went to an oncologist. Doctor here I'm in Houston, Sugarland area. So I went to see Dr. Chima at Sugarland Methodist, and she told me that, based on everything and the reports and the blood tests, I needed to have chemotherapy for 6 months. And this is because the cancer did not go to any other organs, but it did hit like 4 lymph nodes. And apparently if it hits 3 or 4, you need to go through adjunctive, I believe it's called, I didn't look at it, but y'all, if you have colorectal problems and you have this, you know what I'm talking about. So it's like 6 months of care, of chemo. Okay, chemo. It's just, I never saw it. I never saw it coming. So nobody in my family had ever had colorectal issues, problems, cancers. Actually, my mom is 71 too, and she's never had a colonoscopy, which is kind of scary. I know that my dad had told me he'd had a couple of polyps removed, but nobody had had the cancer, so that's not something I ever would have thunk would have happened, okay? So I went, my first chemo session was last Wednesday. It was Wednesday, March 18th. And what to expect? I went and got a portacath in because I was told that was just a good thing to do, because I've been experiencing lots of shots, and they missing and all that stuff, and I didn't want to go through those problems. But I do want to share with you lidocaine. Get lidocaine, okay? Get the port. I have a couple of friends with cancer who both suggested the port just because it's just easier. But get the lidocaine, because you put it on the port like 45 minutes to an hour before you even go, and it just clicks right in, no pain at all. So make sure your doctor prescribes you some lidocaine so that you can do that. That was just a side note, because my friend who had cancer, she said, get some baby Orajel, and because it's, you know, uncomfortable, but just that. So I went, and I'm on the Folfox, Folfox. I did write that down, even though I can't say gastroenterologist or anything like that. I'm having issues. It's probably the chemo. That's what I'm gonna blame it on. Yeah, it's the chemo. Okay, so the Folfox is the folinic acid. That's the fol, F-O-L. The F is the fluorosil, which is 5-FU, the 5-FU. And then the OX in Folfox is the oxyplatin. So they gave me a syringe in the thing that led to the port of steroids. They gave me anti-nausea medication. They gave me Benadryl. They gave me different saline solutions. All of that even before I got the actual chemotherapy. The whole thing is going to take you anywhere. The first time is going to take you anywhere from like 4 to 5 hours. So just plan on 4 to 5 hours, because you know you're going to be seeing the doctor. You know, it's just an experience. Now, I am the type of person that my husband did take me, did settle me down and everything, but he left and he went to work. I am not the person who wants people around. I just don't. I'm just not that person. I feel like I have to entertain and I didn't want to do that. I wanted to be about just meditating, talking to God, and sleeping, because when you get the Benadryl, chances are you're gonna be knocked out. I was asleep, and that was good half the time that I was there. I took my iPad so I could watch a movie, even though they had TVs there. So you might want to see what kind of entertainment things going on there. So make sure that you take something to read or something to watch. And there was a couple of ladies there. One of them, stage 4 pancreatic cancer. They had no cure for her. I guess she was just going to prolong her life. She said that she was diagnosed and had been taking chemo since 2017. And I was like, wow, that blew my mind. And I was really glad that I was not a really nervous, scary, anxious person, because I feel like just talking to her would have set me back. So if you're, you know, that person, you be careful who you talk to. And then there was another lady on the other side of me who, it was her last day. So that was a treat. It was her last day of chemo. So what else did I want to share with you? Okay, so I have 12 cycles, because I was like, what is a cycle? 12 treatments every other week, and it lasts for 6 months. So if I stay on track, it's every other Wednesday. I will go for chemo. And I took a blanket. Now, it's amazing. Right now, all of the stuff is going on with the coronavirus, and it just happened right when I started my treatment. So when I walk around with a mask and gloves on, if I have to do that, I don't look any different from anybody else. Isn't that crazy? That's the craziest thing to me. And as you're going through these treatments, your immune system's going to be suppressed, so you need to keep everybody away from you. You need to keep everything as clean as possible, sanitizing as much as possible. So I could tell you so much about what's going on, because I have 2 kids. One of them works, she's 24, she works downtown Houston. My son goes to University of Texas, El Paso, plays football there. He's home because they kicked him out of school because of the coronavirus. She's working at home. So they're both home. Thank God my husband's still working away from home. I work at home as a Mary Kay sales rep for 27 years. So I'm used to this being my domain. So a lot of changes going on, a lot of people around, a lot of things happening. But I do want to share with you other things that I've not experienced yet. Oh, let me just tell you about my side effects, because I know that's huge. I know that's huge, because when I was going through this is what I wanted to know. First off, this week has been way better than I thought it would be. The only real side effects that I have is I have a dull headache, kind of like at the base of my head and my neck, and sometimes at the front and my eyeballs, but nothing that I even need to take medicine for. I choose not to take medicine extra unless I really have to, and it really is not that I can't work, I can't do anything. And frankly, my energy has been good. I personally, it's weird, have more energy than I did before I started. And I don't know if that was because of the cancer. One thing my doctor did recommend is that I get the vitamin B, as in boy, complex for energy. So I start taking that a day or two before I even started. So every morning I take a vitamin B. I usually have oatmeal and a banana. I just kind of be consistent with my breakfast and 2 boiled eggs, and my appetite has been fine. I've had no nausea, no diarrhea thus far. I hear that every time you go, your cycles can be different as you get more and more of the drugs. So far so good. I did feel a little of the neuropathy, they say, when you feel like the numbness and the tingling and like pins and needles in your hand. Like, you know, when you sleep, you sit on your foot or your leg and it goes to sleep. A little bit of that with a little bit of sharp needle kind of pain when you touch cold things. So cold is not your friend. You know, so forget about it. No cold drinks. And I think one of the things that's worked for me is drinking a lot of water all day. And apparently this chemo is really bad for your organs, your kidneys especially. So water all the time, at least 4 16-ounce bottles, and I would say double that, because I think it's just better that it's flushing out your system. So they gave me 2 types of nausea medication just in case. One that melts in your mouth, I forgot the name of it, and one to take if that one's not enough, I can take 2. What else did they give me? They also gave me a sample pack of oral gel because mouth sores is apparently one of the side effects that might happen. So I just have these things just in case I need them. I do want to say, when you do go for your first chemo treatment, take a blanket. And one of my girlfriends was so sweet. She brought me a blanket with all pink. It's like a pink blanket with white hearts all over it because it was Valentine's Day, and I just use that as my blanket. And I do take something warm and fuzzy to cover up with the top, like a sweater, and socks. And a lot of people have gloves because the neuropathy is that bad for them. They want to cover their hands so as not to touch anything cold, like the refrigerator door handle. And my doctor says sometimes when you open the refrigerator, the cold air bothers you. And one girl had yogurt, cold yogurt, and her mouth was kind of like when you leave the dentist and they deaden your mouth like that. So cold is not your friend. It's just not. So we'll stay away from that. One other side effect that was probably the worst side effect that I had was leg pain in my hamstrings, the back of my legs, and like the bottom of my butt. Oh, I was doing a video conference or a Zoom meeting, and I could not sit down. And what helped that was stretching through the pain. I stretched through the pain. And I've been taking walks. I set my timer on my iPhone to walk 15 minutes, and when it goes off, I walk back for a 30-minute walk. I think it's important to stay positive, choose faith over fear. I'm a spiritual person, and so I'm talking to God and Christ all the time. I believe the big C, Christ, is gonna just conquer just over the little c, cancer, and that's how I choose to think about it. You can comment below if you have any questions. I'm sure there are things I did not cover. I do want to tell you, now that I'm looking at that, the Biotin dry mouth wash is a good thing. My doctor swears by it. I've been using it. The throat coat I got it at HEB. It's a tea, a hot tea that coats your throat when you start getting mouth issues. And this is the Biotine Dry Mouth Spray. So those are some of the things that I want to tell you about today. So this is my first cycle that I'm in. I'll get back in and share with you a little bit later about what's going on with me. They say my hair might thin a little bit, It's not expected to fall all the way out. All of the drugs are different for different cancers in different areas of the body that they treat. So I was really happy about that. I don't know of anything else to tell you right now, but I did want to do this YouTube video because I know that it's a struggle. You know, when you learn this and you have to go through this, you're on the, well, I was like just trying to find people's stories. What should I expect? What should I expect? But so far, so good. But it was just my first round, and I hear that different things happen as you go. So pray for me and I'll pray for you. Comment below if you have questions or thoughts, and we'll get through this together. You have a good one. Thank you.